It's the sweet spot BC is aiming for, to get as close to that line as back to normal as we can without actually crossing it. Now, I want to illustrate how that could look with the new models. Take a look at the latest projections here today. This is key. This shows that if we went back to 100% the way we were, this red line here, look at how critical care cases will suddenly surge. And even at only 80%, that's this pink line here, if we went back to 80% to normal, we'd still see a significant spike and those cases accelerate quite quickly. Right now, though, where we're at is currently way down here, the purple line. We're at about 30-35% of normal interactions at the moment with our current measures. The orange line, slightly above, is key. We could double the 30% down here to about 60% and still keep that line relatively flat, as you can see. So this is the goal, and Dr. Bonnie Henry outlines what that could look like when it comes to the retail sector.
So it's still having the online, the sort of mixture of online and in-store experience, if you will, reducing the numbers of people that can be in a store at a period of time, making sure that we have hand hygiene available for people. How can we lift the restrictions on restaurants and pubs within that framework?
But she cautions we're not there yet in being able to expand our personal interactions. We're still hovering kind of at that tipping point, trying to contain various outbreaks and trying with community cases that are still incubating not to see those transmit as well.
Okay, and Tanya, the province is also highlighting the most effective and least effective measures in trying to contain the spread. What are those? Yeah, Mike,
one of the slides from today's epidemiological modeling was an inverted pyramid illustrating just that. Take a look at it here. So you can see it has physical distancing at the top and being the most effective. Next is engineering controls. That's things like those plexiglass barriers we're starting to see in the grocery stores now. Below that, administrative controls. That's similar, things like putting the tape on the ground to mark 2-meter spaces between people. And at the very bottom, you see PPE, personal protective equipment, like those homemade masks. They're suggesting that they're the least effective way to reduce transmission. And so why the physical distancing is so important? Well, Dr. Henry says reconnecting with even one additional person outside our current household bubble can lead to exponential spread.
When you invite one person outside of your immediate household bubble into your home, you're also inviting all of the people in their bubble, the people that they've had contact with. And that includes people from their work, from their home, and others that they've had close contact with. So these physical distancing, and how we manage those in the coming months is going to be really important.
Now, the BC government will take the latest modeling projections that we saw today to finalize its reopening plan in the next few days. And Premier John Horgan is expected to outline that rollout come Wednesday. Mike, Anita?
We'll look forward to that. Thanks, Tanya. Tanya Fletcher reporting live tonight.